The protocol wizard, designed specifically for BrainAvatar, has a unique feature called the PW editor. It can be accessed in the upper left-hand corner. Open PW editor. Once we open up the PW editor, we have access to the BrainAvatar Studies folder. We'll be looking at two different cases. First, let's open up Rob, and there is Rob's eyes closed EDF file. This is a full QEEG recording that has not been edited and cannot be used to create accurate brain maps, but we're going to edit it right now. First, I'm going to click, and it will populate the file name window, and I'll click Open. When we open up the PW editor's current settings, we'll see the sensitivity is automatically set to high, the muscle detection is set to high, the eye movement detection is set to high. So what will happen if I click Process the EEG? Okay, I'm going to process or edit this file, and the results are 41 seconds. Ideally, we have over 1 minute. 45 seconds is about 80% of what we want. Over a minute is closer to 100% of what we want. And a shorter file means fewer artifacts and will produce a better brain map. So my sensitivity, I'm going to move it all the way to low. Let's see what happens. I'm going to process the EEG. I went from high to low. I'm going to process the EEG again, and what will happen? Now it's 2 minutes and 5 seconds, which is more than enough for me. And yet I would rather be just a little bit over 1 minute to improve my accuracy. So I'm going to bring the sensitivity detector between high and medium, and I'm going to process the EEG again. And now it's over a minute and 22 seconds, which is ideal as far as I'm concerned. I'm going to export the EEG, and notice Rob's folder is immediately opened. So what did it look like before we edited it? Well, this will open up BrainAvatar, and here is the raw data before being edited. We're seeing electroocular artifacts, quite a few eye movements, which are EOAs. We're seeing some EMG, a lot of EOAs, a lot of eye movement. So that's what it looks like before we started. Now, what does the edited file look like? Notice the edited file looks beautiful. It's just what we need to produce a very good brain map, virtually free of artifact. Our next case is much more difficult. It will be a 6-year-old child. Again, let's open up the PW editor in the upper left-hand corner, and notice we have the folder of a 6-year-old. We're going to load in her eyes open EDF recording. And again, just like our previous one, it defaults to high, high, and high. Let's process the EEG and see what the results are. Just 29 seconds, which is not enough to produce an accurate brain map. So what if I move the sensitivity all the way to low, and I'll click Process the EEG again? It's still 29 seconds, not much better. So let me go back to high, and now I have two choices. The EMG detector, the high setting can be turned to low, or the EOA detector, the high can be turned to low. Well, I'm not going to do both. I'm just going to start with the muscle detection. I'm going to relax it from high to low and process it again. It's went from 29 seconds to 35. Not enough. 45 seconds I consider to be the very minimum. I prefer to have a little bit over a minute. So I'm going to go back to high with the EMG detector. And now with the EOA detector, I'm going to go from high to low and process again. Remember, we're starting at 29 seconds. And now it's 1 minute and 2 seconds. I'm going to export the EEG. And now what do we have? We have Allison's original file. Let's open that up. Look at how messy this is. EMG, EOA, all kinds of artifact. That's where we're starting from. Now, what does the edited file look like? Notice there's a little bit of EMG, not that much, and a little bit of EOA. Now, we have over 1 minute of data that can be used to create a brain map. So that's what we have with two cases. One case was easy and the other case was more difficult. With skillful use of the high and low detectors for EMG and EOA, we can produce a quality edited recording, if that is possible, with the PW editor.